Greetings, students. This is Dr. Weaver, and I wanted to go ahead and do another voiceover on our discussion, effective communication, and conflict resolution. All right, this is chapter 19. In class, we are going to discuss the slides 1 through, I believe, 24. No, 23. All right. And because it is a longer presentation, I decided to do part of it in class and also part of it as a voiceover. It's not that long. I mean, it's like maybe a total, maybe 34 slides where something has to more or less be discussed. So it's not as bad as I'm making it out to be, I suppose. But anyway, total is 38 slides. But I mean, some of those are the critical thinking, or the, what do they call it? Basically, they're the questions that that you would typically, excuse me, ask our students. When we are having these discussions, it is the critical thinking questions. I just wanted to make sure I was saying that right. So anyway, we're talking about, or we're continuing with our discussion about effective communication and also conflict resolution. I'm sure you guys know by now, especially the fact that you guys are college graduates and you've lived a certain period of time on the earth. You should realize by now that effective communication is just paramount. I mean, I can't say enough how important it is to effectively communicate. A lot of students at times when we're doing a lot of writing, particularly in a bachelor's program, and also specifically nursing. They feel that all this writing, why are we doing so much writing? It doesn't make any sense. I mean, they feel like this is not nursing, and why do I have to do this? And they just, again, they want to get to the clinical stuff and not some of these other discussions or topics that are germane to the professional nurse. But just think about it. I mean, when someone else's life is in your hands, you want to be able to, if I'm a patient, I want the interprofessional team to effectively communicate. I don't want anyone dropping balls and such as that, because then that can be detrimental to my own health. And so effective communication has so many advantages for obvious reasons. It keeps patients safe, all right? And the left hand knows what the right hand is doing. So anyway, I just can't say enough how vital it is to effectively communicate amongst the healthcare team. And also part of this discussion is conflict resolution. Anywhere you go, there's going to be conflict, and we have to give you guys the tools to be able to manage conflict. All right. So let me go ahead and start on this. It's actually kind of late, but I just can't seem to go to bed without doing this first. I should have did it earlier, but I didn't. So here we go. All right. Let me pull this over. All right. So hopefully you guys can see my presentation. Again, we're talking about effective communication and conflict resolution, and we are going to start on slide 25, which is after the critical thinking question. I thought that was a nice place to start. All right. Let me go ahead and expand that. So we're talking about communication and gender, and gender differences. Believe it or not, we all might be, or we all are human beings, but believe it or not, there's a different way that we communicate as far as between genders. A lot has to do with how we were raised and how we were socialized, and so development of course, a truly effective communication it necessitates understanding various circumstances that does influence communication. In addition to the concepts that we are going to discuss in class, characteristics exist that might impede effective exchange of information. Now, issues such as gender differences, and not only gender, we're talking about generational differences. There's cultural diversity, physical and intellectual disabilities, all right? And also dissimilarities in the professional approach of the various healthcare disciplines all contribute to disparate understandings and interpretations. People from all types of backgrounds, professional, culturally, racial, gender, this can lead to a disaster. But again, this is one of the reasons why we have these discussions, so that we might give you some tools to be able to effectively communicate with the interdisciplinary team, which also involves the family, right? Now, for the most part, women work towards, as far as focusing on the woman or women and how you guys communicate. Women work towards a compromise, even when it means relinquishing some of the original goals. Often women use indirect channels such as questions to guide a conversation towards the point they want to make. All right, it is important to preserve relationships as far as women are concerned. That is very important to preserve relationships. Now, the role of peacemaker and nurturer has been a traditional expectation of women throughout the ages, so that has not changed. Women have been socialized, of course, to believe that assertive behavior will endanger relationships, and that conflict should be avoided in order to preserve friendships. Now, as far as men are concerned, men work toward winning. They want to win. Traditional role expectations of men have included provider and protector. All right, men learn early in life how to focus on goals and move aggressively toward accomplishment. Team sports, of course, teach men that relationships are not destroyed in the battle. Consequently, men have been socialized to behave assertively when such performance is needed in pursuit of the goal, and then move on without loss of friendships. Now, men typically use communication as a tool to deliver information, whereas women value the process of communication itself as an important part of the relationship. Therefore, in an effort to improve communication, men might try spending more time in discussion, and women might try to phrase comments more succinctly. Right? Now, progress has been made over the years as women move into more lateral working situations, but the problem with gender communication style differences continues to persist, believe it or not. Even though women are taking on some of the roles that men traditionally have held, these communication styles have not changed a whole lot, even after all these years. Now, Bucher, an author, echoes these thoughts in light of today's work environment, Little did we know that the communication differences we experienced as children on the playground would move from the classroom to the boardroom. Right? Neither men nor women are better communicators, so they're not saying that. They're just different. And of course, awareness of this difference supports effective communication in the healthcare environment, where effective transfer of information is essential, very essential. Now, as far as individuals with physical or intellectual disabilities, we want to make sure when we're dealing with someone with these disabilities, we want to speak directly to the patient using a normal tone of voice and inflection. Oftentimes, in what you will find in the hospital is that sometimes we tend to speak extremely loud. Obviously, we know that when we're taking care of someone who is older, maybe perhaps the 70s, 80s, and whatnot, we more or less assume that they cannot hear, and so the author tells us to speak in a normal tone. All right, and also hopefully, you recognize that if a patient does normally wear hearing aids, to make sure they have them in, right? Communication difficulties associated with physical or intellectual disabilities cannot be equated with complete lack of cognitive understanding. These folks, they may have some physical or intellectual disabilities, but we cannot think that that they just totally lack any capacity to understand. All right, so keep that in mind. You use modalities of communication that are familiar to the patient. And of course, when we do admissions, we typically want to ask patients, what is their best way to communicate? What language do they prefer, and so forth. Allow as much physical movement as needed and possible. And of course, reduce outside stimulation. Of course, less is more. Take a look at page, where did I do that? Take a look at page, what is this, page 349, table 19.3. It presents a list of the most common problems encountered by disabled individuals, along with appropriate and inappropriate responses. So take a look at that. They actually break it down pretty good. Let me see if I can possibly, I think I pulled it up. Hopefully you can see this, because sometimes you have to reshare when in Teams, but hopefully you can see this. It is, again, the table 19.3. And just to give you an example, so the title of this particular table is Communication with Individuals Who Have Disabilities. And the first one is speak directly to the patient using a normal tone of voice and inflection. So I did mention that. But it also says do make eye contact when culturally acceptable. There's some cultures that they don't look at you in the eyes. They look off to the side because it is a sign of respect. So consider that. But it also says do not look over the patient or talk to the accompanying significant other or caregiver. In other words, the patient is sitting in front of you, but you're looking at their significant other or their family member speaking with them. And of course, the author says not to do that. Make sure you're looking directly at the patient, speaking directly to the patient with a normal tone. And so take a look at the rest of this information here. It just gives you some tools, different ideas as to how to communicate with our patients. Go back here. I did that one. All right, so remember I talked about, as far as communication, differences between different groups, gender, cultural, and so forth. But the book also talks about generational differences. And when we talk about generations, we talk about the traditionalists, baby boomers, Generation Xers, millennials, and homelanders. Honestly, I never heard of the homelanders. I guess I've been behind on my the different generational groups. All right. Now, in recent years, much attention has been focused on the fact that our society has at least four distinct generational, generational groups. All right. Now, as far as the times or the time period for each group, traditionalists, they were born before the mid 1940s. Baby boomers, they were born between the mid 1940s and the mid 1960s. All right. The Generation Xers, they were born between the mid 1960s and 1980. Generation X, or the millennials, were born between 1981 and 2000. And the homeland generation, or homelanders, variously described as born since 9/11 or 2000 would be this particular group. Now, awareness of generational differences and the accompanying differences in communication styles is important to nurses from two perspectives. Communication with the patients and families, and also communication with one another. You can only imagine on a nursing unit, you may have some nurses who have been in this profession for 30 years. So they might be well in their 40s or 50s, perhaps even 60s, right? And then, of course, you have these new graduates, they're in their 20s and whatnot, large generational gap and what have you. And so we have to learn the different characteristics of these different groups so that we know how to communicate with one another. All right. Now, when we talk about traditionalists, members of this oldest surviving generation, they like to follow rules. They value authority, and also formality, and they also are more interested in following a chain of command. They take pride in accomplishment. They are strong decision makers, and they have a good sense of self. Right now, tradition is also important to them, making them more likely to make decisions according to what has or has not worked in the past. As far as baby boomers, their particular characteristics, they grew up in an era of prosperity that formed, this actually formed their worldview, their values, their work ethic. Now, although they questioned political policy, authority, and social mores, they ultimately embrace work as a definition of self-worth, adopting a strong work ethic, becoming more goal-directed, and experiencing the accompanying struggle with work and personal life balance. All right, so they continue to struggle with that. That work-life balance, I think, seems like everybody does, right? As far as Generation X, the milieu or the environment that Gen Xers experienced during their formative years was fraught with insecurity. All right, the breakdown in many of the traditional security sources previous generations enjoyed during their day helped create a generation of independent problem solvers. Right, there were increases in divorces, the prevalence of HIV. There's gangs, abortions, and the exposure of corrupt governmental officials and policies created an unstable societal environment in which individuals could meet challenges, recognize and also respond to opportunity, and also become comfortable with diversity excelled as well. The millennials also value autonomy in their work, decision making, and life choices, but at the same time value the team, and teamwork. Right. So if you can think about the characteristics that I just described here with the millennials, let's just say you as a 50-something-year-old. Let's say maybe a 60-something-year-old, you're a baby boomer from that generation. And let's say if you were in charge of this group of young nurses, these millennials. I'm sorry, those were the Generation Xers. All right. Apologies. Anyway, so one of the characteristics of these folks is autonomy in their work. And so the question you have to ask yourself is, what if you were the type of manager that likes to micromanage, right? Do you think that you will have healthy, not healthy, but happy employees, those of this particular generation? Probably not. And so as a manager, if I was a manager, I would become well acquainted with these different characteristics related to these generations, so that I might manage and lead accordingly. So just think about that. Now we're talking about millennials. Millennials are the most diverse and most globally thinking generation in the workforce. All right, in large part because of technology, right, which provides an unfettered access to global issues and occurrences. Right, so you can see that just with technology, computers, social media, and so forth, they have a more global perspective, and what have you. Now, many come from or are close to non-traditional families and have witnessed unparalleled violence within borders of our country. Their comfort with technology and also diversity are hallmark characteristics of this particular group. They do value diversity as well as technology, right? They also value inclusion, team effort, right? Collective action, and they are quite adaptable to rapid change. All right. Now, because they are focused on cohesiveness and peer orientation, they value immediate feedback. And so, again, these are things that are good characteristics that are good for you to know as a leader, and also as we deal with each other. Even if you're not the leader, but perhaps you're one of the staff nurses, maybe you're a baby boomer, and your colleague is someone of these different groups, and you want to know how to interact with one another. All right. Now, Homelanders, this is the line between millennials and Homelanders, or rather, I should say the line between millennials and Homelanders is quite blurry, starting with the choice of years for transition from one to the other. Now, influences on Homelanders include the cascade of occurrences within our borders, starting with 9/11. All right, as well as continuously burgeoning technology. There's so much technology that they have to deal with. The year 2008, with the recession and the election of the nation's first Black president, is heralded as a seminal year in the development of this group as well, which are now reaching working age. Like traditionalists, this generational group is growing up in a time of financial and political insecurity at home and globally. They're comfortable with multitasking, diversity, and technology like no one before them. All right, they grew up in the midst of this stuff, right? Homelanders are expected to pursue college education as a matter of necessity, as the gap between those who are financially sound and those who are not continue to widen, right? So they will be the group that is certainly interested in education a lot more than those before them. All right. So the next slide here deals with cultural diversity. I actually used to teach this particular course. Sensitivity to cultural differences is an integral part of the nurse's responsibility. All right, we have to be sensitive to the various cultures because they are our patients. Many cultural beliefs are tightly interwoven with strong religious convictions. All right, societies throughout the world depend on a variety of alternative healing sources as strongly as, or even more strongly than on medical science. You know, you have the complementary types of medicine that we have to think about: acupuncture, massage, meditation, and so forth. Some people rarely have an opportunity to interface with medical science as it is known in developed countries. I mean, they just don't have the resources, the monies, if you will, to deal with the medical or interface, as the book says, in medical science, and so therefore they resort to other ways of treatment. Now, the obvious difficulty is a potential language barrier, of course. Even if the person speaks English as a second language, the preponderance of slang terms and colloquialisms can confound or confuse a literal translation. And so don't just assume that just because someone speaks English, that you know, the use of slang terms and, as the book says, colloquialisms, they can cause a problem with the translations at times. So we have to be very thoughtful concerning this. Additionally, the stress associated with illness and possibly hospitalization only adds to the potential for misunderstanding and frustration, because it is a very stressful environment, you know, especially if people, you know, they have a pretty serious health concerns. Now, fortunately, most communities have interpreters willing to translate in the healthcare setting. And so most hospitals will have a way for you to have someone who actually speaks the language who can help you communicate. They do not recommend that you use a family member and such as that, but that you use the interpreters that are hired by the organization. Now, the variety of language interpreters, including sign language for the deaf, are available even in smaller communities, is rather surprising. All right. Now, many forms of communication do not carry the same meanings in various cultures. All right. Now, in some instances, direct eye contact is to be avoided if possible. Touch, even touch, also considered a positive communication technique in the Western culture, may be perceived as a serious invasion of privacy, of course, in other cultures. Some gestures considered innocuous rather, in one culture may represent vulgarity in another. So we have to be aware of all these differences and whatnot, and not try to Americanize or Westernize everyone. Now, some cultures strictly adhere to paternalism unless the male head of the family agrees to a procedure or treatment. The family member will refuse under any circumstance. Now, although many people share a sense of modesty, some cultures experience a greater feeling of violation at having to expose certain body parts than do others. Right now, even in my health assessment class, we have we do have some students who they don't mind touching someone else, right? As far as practicing in the lab, but they don't want anyone to touch them. All right. So, but I don't know if that's culture or if it's just some people just not very comfortable in their bodies and what have you. So. Now, the prudent nurse must become knowledgeable about the specific cultural practices in the region of his or her employment. You may live in a region where there is a large Asian population, where there's a large Latino population, where there's a large African American population, and so you have to be you have to become very knowledgeable so that you know how to engage effectively, because communication, all of this we are going to need in order to effectively communicate so that the patients can follow the healthcare plan, if you will. So something to think about. I will say that there was a time in nursing that you didn't have a whole lot of classes as far as cultural diversity, but it's pretty common nowadays. All right. I mean, you guys are even getting a taste of it now at the graduate level, or rather, when I was teaching actually cultural diversity in a DNP program years ago. Yeah, it just depends on which program you go into, and of course, and how much they devote these courses. Of these discussions, if you will, regarding cultural diversity in any given course that you take. And so, but this is, of course, one part of this course. We, of course, go into cultural diversity. Very important topic. So the interprofessional team communication, as you guys know, in healthcare, you're going to have the nurses and the doctors and the pharmacists and the PT, OT, ST. I mean, all these professionals are on these teams now. And one good reason for that is that knowledge is not contained in a vacuum, and no one discipline has all the knowledge, and therefore. We form these interprofessional teams so that when we are working with our patients, we are able to devise a more comprehensive, workable plan of care that the patient is willing to follow. Now, the interprofessional team is composed of people from a variety of disciplines who approach healthcare from a unique perspective of the theories and therapies of their individual profession, right? They have a different focus, in a way of speaking. Now, all of the positive communication techniques previously discussed must be used to clearly understand another's perception. Listening is, of course, an essential tool for determination of the intended message, as seen from the unique perspective of the other discipline. Frequent clarification and a sense of safety are really important as people explore the meanings that each person attributes to the situation and the discipline-specific suggested solutions. All right. Sometimes, well, of course, a pharmacist will be able to be a whole lot more knowledgeable about pharmaceuticals and whatnot. And so, we continue to defer to one another because it is based on the expertise of the discipline. All right. Now, realization that the fundamental goal of all healthcare professionals and also of ancillary staff is to provide quality patient care should facilitate positive communication. And that's what it's all about. That's the goal. That's the end point, is to provide high quality care to our patients. And so Communicating amongst the interdisciplinary team is certainly paramount. As far as confidentiality and privacy is concerned, no discussion of communication is complete without reference to issues of confidentiality and, of course, privacy. A very important topic for you guys because you will have access to a lot of sensitive, personal, confidential information. All right. Now, breach of confidentiality and the patient's right to privacy through careless gossip has ethical and also legal ramifications, which we'll talk about. Sometimes there is thoughtless conversations in the elevator. Sometimes the healthcare team, or those are part of the healthcare team, are gossiping in cafeterias, in parking lots, and any other public place that has created heartache for the patient and the healthcare provider alike. And so in these areas, we must be extremely careful. Right? Just imagine you getting on an elevator and you're talking about a patient who just really gave you a lot of problems. And that patient is either a family member or just people in general are on the same elevator, and they get to hear what you were saying about this patient. It can cause some major issues for you, so be very careful. Now, other sites where communication about confidential or personal patient issues needs to be controlled include the nursing station. You have to be careful even around the nursing station. Sometimes family members are passing by the nursing station or the room. Their loved ones or family members' room is situated next to the nursing station, and so you have to be extremely careful. Any desk or tables along the halls and also the utility rooms are places, again, you must still be careful. Now, such locations are not often viewed as public places, but many people pass by these areas and overhear information. And so think about that. Now, exchange of patient information should occur only between persons with the need and right to know. All right, and should take place in private areas. So, in other words, just because you're going to be working with a slew of other clinicians on the floor, but if in effect, the only one you should be having this discussion with is someone who really needs to know this information. Say, for example, if you're getting ready to go on a lunch break, or obviously if you're getting ready to give a report, you only should be rather giving that information to that individual where you're reporting to, in other words. But everybody, just because you're a nurse on that unit, it doesn't mean that you have a right to have access to that information. That's pretty much what I'm trying to say. That doesn't make you privy to that information, basically. Oh, the old social media. All right. Now, the professional value of social media comes with a very serious caveat. The patient retains his or her right to confidentiality and privacy in every medium. I don't care what it is that they deserve or they have a right to privacy. Not only must nurses be very careful in not using a patient's name, but they must be thorough in avoiding any other type of identifying information. Right? You know, sometimes you take a picture of, let's say you're taking a picture of something in the healthcare setting, maybe the wall, or maybe the doors, or some area on that unit that can be recognized by others. So again, you have to be extremely careful as it relates to patient confidentiality. All right. Now, such information may include geographical location, facility name, because some people know the decor of different units and whatnot, so that could give it away. the room number, of course, or the patient's age, gender, and diagnosis combined with any of these data, right? Because you know how people, all they have to do is put two and two together, and it's a wrap. We've had some celebrities, if you will, athletes in particular, who have come to the hospital, and we've had people who, or staff rather, they would access their record. And let me tell you, whenever you know that there's a VIP that is coming to your facility, I'll tell you right now, do not be tempted to go into that record, especially if that patient is not under your care. Now, if you're taking care of the patient, that's one thing. But if you're just curious, become uncurious, all right, for lack of a better word. Now, nurses, like most of our society, are of course connected to their personal lives to multiple online social media sources, of course, such as Facebook, Twitter, and of course various blogs. Sitting home alone with a computer, it may give you or create a sense of privacy, but nothing could be further from the truth. Postings intended for immediate family or friends and protected by the site's privacy policy are not inviolable, right? People can still figure out things, all right? It's not total protection, if you will. Now, anything posted online exists forever on a server somewhere. Even if you were to delete it, believe it or not, it can still be retrieved by those who are skilled in information technology. Now, this information is forever discoverable in a court of law and can be used in a trial against you. All right. Now, friends might find your story so touching, all right, or endearing that they repost to their friends. And the story takes on a life of its own with no available control of dissemination on your part. You see, this thing can just get out of control and cause you a lot of problems. So again, I would tell you guys to be extremely careful. Now, a good example of the unintended outcome of a moment's misjudgment is also presented in the NCBSN's 2018 social media guidelines. So a nursing student took a picture of a minor child with permission, and that's the key, with permission, and posted it to her Facebook page with a comment about his bravery during his illness and how much she loved her chosen profession. Sounds innocuous so far, right? Now, although she did not identify the patient by name, the patient's room number was visible in the photo, and she probably thought nothing of it. All right. The patient and his hospital were identified by others viewing the post. All right. Now, ultimately, the hospital was charged with a violation of the Health Information Portability and Accountability Act, or HIPAA. The nursing program was barred, and this is really significant because clinical rotation sites are very sparse, right? And so the nursing program was barred from the clinical site, and that may have been a major clinical site for that institution. And of course, the student was expelled. All right. Now, if that happened to a student, just imagine what would happen to you and your license in particular. Now, nursing board actions against a student who makes inappropriate disclosures on a social media site could include unprofessional conduct, unethical conduct, moral turpitude, mismanagement of patient records, revealing a privileged communication, and also breach of confidentiality. These are the offenses that can be taken against you, or even a student. Now, the nursing students' actions in this example also violated state and federal law. all right, putting her at jeopardy of both criminal and civil penalties, all right, including fines and possible jail time. I don't know if it got that far, but, you know, certainly it was never the student's intent to behave unethically, but her actions created this cascade of events. As a profession, we are held to a very high ethical standard to protect our clients' confidentiality. We must be very attentive to our actions, of course. Now, proper use of social media can open venues of learning. You know, there are some advantages, of course. There's venues of learning, career advancement, mentoring, networking, also enhancing the global perspective in your nursing career. So use this opportunity wisely and with consideration of the permanence and wide visibility beyond anything we could have imagined, and also the potential impact of your posting. So there's some positive advantages, benefits, if you will, but there's also the ramifications of such as what this young lady did can be very painful, to say the least. As far as online etiquette, so interactions online are guided by the same sense of decency that any other style of communication dictates. And talk about some of the simple rules. We want to be nice, be ethical. Don't say anything to someone online that you wouldn't say in a face-to-face conversation. And certainly don't fan the flames of conflict or anger, right? Remember TMI. It stands for too much information. But remember that concept. Don't give more personal information than others want to hear. Write with clarity. All right. You want to reread what you've written to determine whether it is clear or whether it might be interpreted differently from what you intended. I always go back over what I'm getting ready to send several times sometimes. Respect others, including their privacy. Use discretion. Online postings live forever more in cyberspace, right? So use discretion. Obey copyright laws. That can get you jammed up as well. Now, characteristics of professional communication. So a major goal of communication is to establish understanding and cooperation with others. However, much of our social environment is characterized by interactions that involve conflict, there's misunderstandings, and a failure to communicate. When more than one person is involved in the interaction, a potential exists for disagreement and misunderstandings. You all know this. When the interaction becomes stressful, taking on a competitive, hostile, or even an oppositional nature, it can be classified as conflict. Now, conflict, like stress, can have both beneficial and also detrimental consequences to an individual. Some of the benefits that may arise from a conflict include recognize talents and innovative abilities. Right, these are some of the benefits of conflict. Identify an outlet for expression of aggressive urges. Introduce innovation and change. Diagnose problems or areas of concern. And establish unity. Now, harmful consequences of prolonged conflict include a negative effect on emotional and physical well-being, an emphasis on one's own welfare over that of the group, a diversion of time and energy from the more important goals. It can just take us away from what we're supposed to be doing, and also financial and emotional costs and personal fatigue as well. Those are the deleterious effects of conflict. So it's not all bad, all right, but it's not all good. Now, most of us experience abundant opportunities for conflict, which may be related to the fact that we bring to our relationships an accumulation of attitudes, beliefs, opinions, and also habits that are different from others. Thus, conflict is normal, and it's not necessarily something to avoid. All right, so we're not telling you to totally avoid it. It is normal. Just need to have the tools to be able to navigate through such conflict. Now, although uncomfortable, conflict signals the presence of different points of view, which can spark creativity, nourish growth, and also strengthen relationships as well. Now, maintaining an environment supportive of professional, clear, sensitive communication enables individuals to fight more productively. There's a such thing as fighting more productively, with less hurt and with a greater chance of resolving differences and also disagreements. Now, characteristics of environments that support professional communication are described on page 353. So take a look at page 353 for a description of these characteristics. Just to name a few, adopting these communication attitudes and using the positive communication strategies previously discussed can prevent most episodes of conflict in the workplace. And again, this is why we give you guys these tools. However, situations are bound to arise in which the nurse would need to know how to handle a conflict situation and achieve a more positive resolution or outcome. Right? And I told you guys that the thing about many of the nursing classes that we take is that much of it can be applied to our ordinary lives. And that's the beauty of it. You have a lot of tools to be a productive human being in your life. So, again, we continue with conflict resolution. People's ability to connect with another, especially during times of conflict, depends on their capacity to tune into the subtle messages that reveal how a message is actually being received. We seldom create conflict intentionally. I don't think people are actually just out to start trouble, if you will. But rather, it occurs because we may not be aware of how our own behavior contributes to interpersonal problems. You have to be self-aware. Because interpersonal communication is fragile, there may be barriers to an effectual and meaningful process. Now, successful resolution to conflict begins to occur when people are aware of their own and others' feelings and emotions. All right, you're considerate. You're considering yourself, but you're also considering that of others. All right, and also believe that these concerns are relevant and respected. Right, so there has to be that mutual respect. Now, the first step in conflict resolution is to recognize how individuals manage conflict. Awareness of one's usual conflict resolution style would go far in understanding how one's own behavior contributes to disagreements. Another and very important step in conflict resolution is what? Active listening. You have to listen. Now, many of us are apprehensive or reticent when communicating during times of conflict. But active listening can reduce the emotional charge from the situation so that both parties can deal with their differences and assist in resolving the conflict. Now, some rather excellent active listening techniques and examples are also provided in Table 19.4. So go ahead and take a look at that when you get a chance. Finally, the principle that underscores all successful conflict resolution is that all people involved must view their conflict as a problem to be solved mutually, so that each has a sense of winning or discovering options that are acceptable to all. Now, although this is an easy principle to understand, it can be challenging to put into practice, of course, easier said than done. If both people can remain open, if you're honest and respectful of each other's positions, feelings of resentment may be reduced. So just consider that. Now, these are some of the conflict resolution styles. Avoidance. These are just some of the things that the people tend to do. There's avoidance. One person uses passive behaviors and withdraws from the conflict. Neither person is able to pursue goals, and this is not very good. There's also accommodation. One person puts aside his or her goals in order to satisfy the other person's desires. This also is not desirable. Force, and we know this one is not good. One person achieves his or her own goals at the expense of the other person. All right. And a compromise. Both people give up something to experience partial goal attainment, something that is desirable. And collaboration, of course, both people actively try to find solutions that will satisfy them both. That is desirable as well. Now, I also want you guys to take a look at box 19.4 on page 354 for the complete list of professional responses to verbal conflict. When the conversation is escalating, try to move to a private location. Speak in a normal tone of voice. Don't raise your voice. Use I messages. Don't be that you this, you that, and whatnot. That's more offensive, and it causes the person to get on the defense. Maintain eye contact throughout. Maintain an open body stance with your hands at the side or open toward the individual, but not invading the the other person's space. You know how sometimes we cross our hands or our arms and whatnot, and of course the author does not recommend such a stance, but one of openness, if you will. Do not physically back away unless you perceive you are actually in physical danger. All right. Offer explanations, but do not make excuses. And if you say you will take care of something or report something or change something, do it. Do it. All right. And again, just look at page 354, box 19.4 for the complete list. Those are some really great examples. And of course, the last thing, or the last slide, promoting a professional nursing image. Use positive communication techniques. Provide a safe environment in which patients and coworkers can ask questions and also learn. Focus energy toward solving conflict, not creating it. Maintain clear, open, and sensitive communication. All right. And folks, that is it. That is it. So that wasn't too long. I don't think that was even more than an hour. So that I think that wasn't as painful as I thought. All right. Yeah, that's box 19.4 that I was telling you all about. Professional response to verbal conflict. So there's a lot of nice tips here that I like. And again, tools that you all will need in order to be good conflict resolution, those who resolve a conflict and whatnot, and of course not add to it. And so these are really some nice tips for you to think about. Anyway, that is about it. I will go ahead and stop right here. If you guys, of course, have any questions, feel free to shoot me an email. Thank you.